Our cover story tonight is about the man leading the global fight against the coronavirus, or the man who should be leading this fight, Tedros Adhanom Ghebreyesus. He's the Director General of the World Health Organization. Dr. Ghebreyesus has the most important job in the world right now. His agency is in charge of the global response to the coronavirus pandemic. Ideally, it should be the WHO's response that should dominate the news. But it's Dr. Ghebreyesus who is in the headlines, and that too for all the wrong reasons. The Wuhan coronavirus is now a pandemic. It did not have to be. Almost 1 million people have been infected by it. The number could have been much smaller. The virus could have been stopped had China taken timely action instead of orchestrating a cover-up. China failed to contain the Wuhan virus. The world is paying the price for it now. Where does the WHO Director General come in the picture? He had a role which he did not fulfill. And now there is a big question mark over his credibility. Since the beginning of this outbreak, he has defended China. Not just defended, he even praised China. Is he blind to China's follies? Or is he turning a blind eye to China's actions? The whole world can see China's lapses, but the man who heads the World Health Organization says this in China's defense.
During my visit to Beijing last week, I was so impressed in my meeting with President Xi at his detailed knowledge of the outbreak and for his personal leadership, but also at his commitment from the words he told me I will share with you. We will take serious measures at the epicenter, at the source, in order to protect our people and also to prevent the spread of the virus to other countries.
Impressed, he says, by the personal leadership and commitment of the Chinese leader. And he said this in February. And with each such statement, his credibility and that of his organization takes a beating. The WHO is now being called the Wuhan Health Organization. I'm sure they're aware of how they're being slammed the world over, and yet they do not course correct. Do you wonder why? Why is the WHO so helpless? Why is Tedros Adhanom Ghebreyesus towing China's line? We dug into his past to look for the answers, and we stumbled on a very interesting story. Listen to this. Dr. Ghebreyesus, the man on your screen, comes from Ethiopia. His election as the WHO chief was unprecedented for two reasons. A, he was the first African to be appointed Director General, and B, he was the first non-doctor candidate to get this post. He's called Dr. Ghebreyesus, but he does not have a degree in medicine. He has a PhD in community health. So how did he become the WHO Director General? His appointment, in fact, any DG's appointment, is made through an election. And Dr. Ghebreyesus ran a successful campaign to get this job. He had powerful backers, no prizes for guessing who. The Chinese were backing him from the very beginning, and this is a matter of record. Dr. Ghebreyesus' campaign had China's support. Beijing voted in his favor. They even helped him whip the votes. And this is just one part of his link. The second part relates to his previous job. Dr. Ghebreyesus was the health minister of Ethiopia. His record was controversial. Many cited it as a reason why he should not be the chief of the WHO, but China prevailed. So what did he do wrong? Covered an epidemic. Would you believe it? Under him, the Ethiopian Health Ministry was accused of hiding suspected cases of cholera. He's done this in the past. The third part of our story features the First Lady of China. Her name is Peng Liyuan. She is President Xi Jinping's wife and a WHO Goodwill Ambassador. It's a post that she's held for many years. She was appointed under the previous Director General, but she has been working with the current one. We cannot prove how this influences his decision, but we can prove the proximity. Dr. Ghebreyesus has also served as the Foreign Minister of Ethiopia. For more than a decade now, Ethiopia's economy has been largely dependent on China. Between the years 2006 and 2015, China and Chinese entities have loaned more than $13 billion to Ethiopia. Dr. Ghebreyesus served as Foreign Minister from 2012 to 2016. Join the dots. And we're not done. Soon after taking office at the WHO, Dr. Ghebreyesus took a controversial decision. He proposed the name of Zimbabwe's dictator Robert Mugabe to become a WHO Goodwill Ambassador. Why is this curious? Because Robert Mugabe was China's man, financed and armed by the Chinese in the 1970s and supported for decades. The proposal to make him a WHO Goodwill Ambassador was met with outrage. Dr. Ghebreyesus had to drop the idea. And now once again, he's in the news for hiding an outbreak and making outrageous statements. Is this payback for China's support in 2017? The WHO is yet to acknowledge the evidence against China. Dr. Ghebreyesus now appears daily before the press explaining in detail the increasing number of cases every day and increasingly echoing Beijing's words. The World Health Organization was not always so compromised. When the SARS outbreak happened in 2003, the woman who led the WHO was Dr. Gro Harlem Brundtland. She took a historic decision then. She issued the WHO's first travel advisory in 55 years. It recommended against travel to and from southern China. She called Beijing out. She slammed China for covering up the outbreak, for muzzling whistleblowers, for censoring the media. 13 years on, China is following the same playbook, but this time after installing an ally at the head of the world body.
And joining us now, also on the front lines, Dr. Anthony Fauci, a key member of the White House's task force and the director of the National Institute of Allergy and Infectious Diseases. Doctor, good morning. It's good to see you again. Appreciate you being with us.
Good to be with you.
Let me ask you about what Vice President Pence said yesterday. He said the U.S. trajectory right now most closely resembles Italy. That is not great news. Italy right now represents more than a quarter, almost 30% of all global deaths from COVID-19. Can you explain why the U.S. looks like it's on the same path as Italy right now?
Yeah. It's just the reality, Savannah. I mean, it's the truth. If you look at the curves of the acceleration of cases, hospitalizations, and deaths, you know, it's superimposed, corrected for population. It's a really serious issue. I mean, Italy got hit very hard, and it's very clear that we are getting hit very hard. Right now, the epicenter of it in the United States is New York City. But as you see, it's not going to be confined to New York City. We're going to be seeing this kind of thing in other large cities. It's a very difficult situation, as was predicted. This is going to get worse before it gets better, for sure.
The Surgeon General was on with us just yesterday and said, my advice is that the 30-day guidelines to stay home from the federal government amount to a national stay-at-home order. Is that how you see it too? Do you agree?
Well, yeah, I mean, if you look at what's in those 30-day recommendations of the guidelines, that's essentially what it is. I mean, I know it's difficult, but we're having a lot of suffering, a lot of death. This is inconvenient from an economic and a personal standpoint, but we just have to do it. That is our major weapon against this virus right now. Yeah. We don't have a vaccine that's deployable. This is the only thing we have. And we can get through it if everybody really leans forward and pushes on this.
Can I ask you about that? You know, more states yesterday started having these stay-at-home orders, but not all states do. And even the states that do, some have exemptions. Florida exempts religious services in some cases. I saw New Hampshire had exempted florists at one point. Arizona had exempted hair salons at some point. I mean, with all due deference to states, shouldn't there be a national order, a national lockdown, a requirement, rather than this hodgepodge piecemeal method?
You know, you have a point there, Savannah, but it's one of those things that in our country there still is that issue of central government versus the ability and the right of a state to make their own decision. But again, I agree with you. When you see things like some of those exemptions, I mean, I can't make any official proclamations here, but I can say really seriously consider, are those exemptions appropriate when you think about what's going on? And I urge the people at the leadership at the state level to really take a close look at those kinds of decisions.
Doctor, we're all getting a little bit of a medical education, unfortunately, in these times. And you said on an interview the other day that there was something mysterious, that was my word, not yours, about the pathogenesis of this disease. That was your word, pathogenesis. You said that some people have mild and even no symptoms, and then others who aren't necessarily old with underlying illness get really, really sick, and we just don't know why. Are we any closer to figuring that out?
No, that's going to require what we call natural history studies. I mean, I have been puzzled from the beginning. I mean, that sharp dichotomy that said, you know, if you're older or if you have an underlying condition, you get into trouble. If you're younger, the likelihood of that is still very low, which it is. But it is very strange how one individual can get infected and have either mild or no symptoms, and another individual could rapidly deteriorate with viral pneumonia and respiratory failure. There's something in mechanism, whether it's genetic, whether it's immune response. The one thing I can say that we have to be humble. I've been doing infectious diseases now for almost 50 years. And I could tell you, I don't fully understand exactly what the mechanism that is, and we really need to figure it out. Because it can be completely devastating rapidly in one person and absolutely nothing in another person.
I know our best brains are on it. There's a new study in the journal Nature that showed patients with mild symptoms can shed high levels of the virus early on during the first week of infection. I don't have to tell you how disturbing that is. Do you credit that study?
Yeah, I mean, that's the truth. I mean, we're seeing a lot of things now that are falling into place. Remember, weeks ago when I interviewed with you, I said we know a lot, but there's still a lot that we don't know. I mean, the idea of someone who's asymptomatic shedding high titers of virus is very disturbing, because that person could be out there feeling well and inadvertently and innocently spreading the infection.
Dr. Fauci, it's horrendous to even have to ask you about this, but there's a report in the Washington Post that suggests there have been threats against you, some from admirers, well, some threats, and then some disturbing interest from admirers, but whatever it is, that you've had to increase your security detail. I'm not asking for the details of that, but I will ask you if you yourself feel personally threatened at all. Do you feel safe? Do you feel that your family is safe?
You know, I do, Samantha. I mean, I've chosen this life. I mean, I know what it is. There are things about it that sometimes are disturbing, but you just focus on the job you have to do and just put all that other stuff aside and try as best as possible not to pay attention to it and just forge ahead. We have a really, really very, very difficult situation ahead of us. All of that other stuff is secondary.
Are you okay? Your voice does not sound great. I'm hoping it's just because you've been doing a lot of interviews and briefings and stuff.
No, I am fine. I'm physically fine. But, you know, all I do all day long is brief people, governors, senators, White House, interviews. I just need to keep my mouth shut for a little while. I think it'll get better. Well,
tea with a little honey and lemon for the doctor, okay? Thank you for being with us this morning.
All right.
Our viewers appreciate it.
Good to be with you.
Thank you.
We have tightly contained.
We're seeing a lot of nurses getting sick, incredibly sick.
We are seeing scores of healthcare workers in my own department, get infected, and that's true everywhere.
I know we've all heard of the nurse that passed away recently from the COVID virus. I'm aware of another 40-year-old, otherwise healthy male nurse who's in an ICU and intubated. We don't feel safe.
Some are given one N95 respirator per week. They are not meant to be reused. We're trying to find ways to reuse them because the supply chain is short. People are, baking them to try to kill virus. They're subjecting them to UV light.
The federal government started making suggestions about how to protect yourself with no mask, like using a bandana, right? Which is an absurd suggestion. It's not protective. It doesn't do what it needs to do. It puts medical workers at risk.
Really, I'm calling on all hospitals. I'm begging them to do more. And to the CDC, please reconsider what you are telling us, because it's costing people's lives. Places
are running out of ventilators. There's shortages of masks. The disconnect between what you might be hearing at a press briefing and what I'm hearing at sign out every single day in the emergency department, that chasm couldn't be wider.
Why do we not look like the people in Italy? Why do we not look like the people in China? They have better PPE than we do by far, and they still got infected.
So this nurse in New York City has a point. Look at doctors and nurses, how they're dressed in America. In this case, in garbage bags, literally. Little to none of them have N95 masks, and if they do, they're reusing them. They don't have face shields in many cases. They don't have PPE that's suitable for airborne virus. And now we're looking at Chinese nurses and doctors and healthcare providers. Look at how well China has their people compared to people in America. This man's working for Clyde Health. This is a hospital in Buffalo, New York, the hospital where my wife works. We have hundreds of people sick in this hospital. 2 of the 3 floors have been converted to COVID-only patients. We're looking to fill up a 1,000-person stadium in Buffalo this week or next week. Nearly every hospital now has 75% upwards of COVID patients, and this man has a homemade glitter mask on. This is a similar mask that my wife has. She's also placing hers in a plastic baggie, and it's been 2 weeks since she's been issued a new N95 mask. A month ago, Kaleida responded to my YouTube channel, and they issued email alerts to all the healthcare providers because of this channel. And I know that sounds ridiculous because this is a small, stupid YouTube channel. And they said to ignore this channel and ignore the rumors. This was a month ago. And local news in Buffalo also responded to my YouTube channel, and they staked my house out trying to interview me, and they had reports saying that this channel is spreading false rumors. So we now have the hospital where my wife works at saying this was false. A month later, that same hospital is now pleading for masks, and they don't have their healthcare providers and the people that they are paying to watch sick people during the global pandemic, they don't have them in masks. My wife said that some people at Clyde Health are wearing pantyhose masks that have been donated by the public to them. A U.S. naval ship that is nuclear armed has reported over 100 cases of COVID-19 among its sailors. So far, the American government has been hesitant to let them disembark in quarantine, so the captain has released a statement to the press and said the situation is dire. There's a 1,000-bed American Navy ship docked off of the coast of New York City. Only problem is hundreds of people flock downtown to take pictures of it, ignoring social distancing. So we have over 6,000 crew and passengers between 2 different cruise ships. One of the cruise ships has 4 dead people on board. We have hundreds of people sick with COVID between the 2 cruise ships, and they're trying to disembark in Florida. There is about 100 people that are U.S. citizens on board the 1 cruise ship with the 4 dead passengers. The governor of Florida is rejecting their calls to disembark. Why are people still on cruise ships? This is ludicrous. So in western and upstate New York, coronavirus continues to climb uphill in numbers and deaths. We haven't experienced the so-called peak yet, as the cases are still growing exponentially. On the outskirts of Buffalo, there's a prison where Harvey Weinstein, the defamed movie producer, was sent. However, he has started to infect other patients with coronavirus, and over 100 corrections officers at the jail where he's placed have now come down sick with COVID-19 symptoms. There's also several police officers in Buffalo also sick with COVID-19. So half the jail's corrections officers are now sick. In Buffalo, there are bars and restaurants that continue to stay open despite the statewide mandate to shut down. Restaurants are only permitted to offer delivery and takeout orders, and there was 2 that were still open as of yesterday and had to be shut down. I've also noticed a bar near my house is also still open and continues to have people go inside and drink. So not everyone is following the statewide mandate. In China, and also I've seen reports in South Korea and Japan, that people are getting coronavirus not once but twice, meaning they're getting it, recovering it, and then testing positive a second time. So this is much like the seasonal flu, where every year people can get the seasonal flu, and after about 3 or 4 months, your immunity stops and you can become reinfected.
You see, we are meeting different people. If I'm infected, maybe this man is not infected. I'm spreading the virus to the people. It's not gonna work. It's not gonna work.
The experts fear a catastrophe as COVID-19 spreads through South Africa. We saw one man kicked and punched for standing outside. For this township and many others cannot be policed, and its residents will not self-isolate. As the virus advances, they are running a terrible risk.
So the stakes are very high in Africa, in India, places like Pakistan, Bangladesh, anywhere there's poverty and there's not wealth. But even in places that are wealthy, like London, England, many people are not heeding the advice of the authorities and scientists. There's way too many people, way too close together on the subways and trains there. We can expect this to spread further in Europe, and we can expect more outbreaks like what's happening in Spain and Italy. Many countries in Europe will be experiencing outbreaks like Italy and Spain are, with close to 1,000 people a day dying for weeks on end. This outbreak is nowhere near ending. In fact, it's just starting. But there is a glimmer of hope in these dark times. An infectious disease hospital in southern Italy, in the city of Naples, is providing extraordinary care. And they claim that they have a 0% infection rate among its healthcare workers. This is truly extraordinary and a one-of-a-kind hospital with this claim. You can see that they are wearing extremely advanced filtration air masks, much like a military gas mask. They are called P3 or P100 filtration masks, and they offer a superior air filtration to N95 masks. They can also be sanitized and cleaned and reused more than once. You can see this nurse here is offering instructions and providing medicine to a doctor inside another airborne room. The room has been sealed off through a series of doors, and it uses a series of reverse air filtration, ensuring that all the air is filtered outside of the room and taken out and filtered so that the virus can't enter the main area of the hospital. This nurse regularly changes his gloves and uses sanitizer even between changing his gloves. They're able to administer medicine and instructions to the patients in the room and also the doctors. This hospital tries to have the patients administer as much medicine and do as much things as they can to limit contact. The sheer level of PPE for these doctors and healthcare providers in Italy at this hospital in the city of Naples is one of a kind, and if hospitals worldwide could do this, the chance to eradicate COVID-19 would be high. You can see all the doors, entrances, and exits are guarded by armed police. This is to ensure that nobody enters or exits the high infection areas of the hospital. The hospital has been divided into dirty areas and clean areas with a red and white rope dividing them. The dirty areas are strictly enforced so that nobody wearing PPE, such as this nurse here, can go into the dirty areas, because the PPE she's wearing is about the same level as American and most European doctors and nurses, and they don't believe at this hospital that that's enough. They don't believe that N95 masks are enough protection around the patients. They believe that you need these special suits, these special gas masks, and they have a claim of 0% infection rate among their healthcare workers. In America alone, we've already had dozens of doctors and nurses become sick. We've had healthcare providers die already in America and in Europe. So if all of our hospitals can do this to treat COVID-19, we would have a much greater chance. If we started using science to fight this, not having news articles question whether this is airborne, not having WHO in the news tell the public not to wear masks. Because after watching that video in Naples, Italy, of those doctors wearing those masks, do you really think that masks don't offer protection? No. Doctors are wearing the mask because they offer protection. That's why you need to wear a mask. I found this article. It says coronavirus can survive in a freezer for up to 2 years. It says it can survive in your refrigerator for almost a month. And that's basically what they thought of with the original SARS-1 in 2004. So wash your food off, I guess. How will this pandemic end? The Atlantic is a very respected scientific news journal, and I agree with them. I don't believe this will really necessarily end. I believe that New York will probably get this under control, but then New Jersey will flare up, and they'll get under control, and then California, Detroit, Florida. I believe it will just become like any other virus, like AIDS or herpes or the seasonal flu. I don't see an end in sight until a vaccine can be developed, if that can happen. And I want to take this moment to thank all of the healthcare providers, all the nurses and doctors that have given their lives to fighting this virus. Because it's not only the old people that are dying. So wherever you are, get ready. Because when the peak hits your country, 1,000, maybe 2,000 a day could be dying. It's not what the experts said. It's not the flu. It's not anywhere near the same.